is Joshua. I'm your student nurse. I'm going to do a head-to-toe physical assessment today. I'm going to wash my hands first. Okay, can I see your wrist? Can you tell me your name and date of birth?
Linda Crittenden, 1/15/1989.
Okay, I'm going to get started with your head, scalp, and face. First, I'm going to check your scalp for any lesions or infestations. Okay, your scalp is free of any lesions or infestations. Now I'm going to palpate your sinuses. Tell me if you feel any pain or tenderness. Did you feel any pain or tenderness?
No.
Okay, next I am going to palpate your frontal maxillary. Did you feel any pain or tenderness?
No.
Okay, next I'm going to palpate your auricles, in your lobes. Did you feel any pain or tenderness on the right side? Or on your left side? Any on your left?
No.
Okay. I'm going to look in your ears for any drainage, discharge, or blockages. Your left side is clear. Your right side is clear. Next I'm going to check your eyes. Your eyes and your eyebrows are symmetrical to your face. I'm going to check your conjunctiva. I'm going to pull down on your lower eyelids. If you could, look up for me. Okay, your conjunctiva are pink and moist. Next, I'm going to check your sclera. I'm going to pull up on your upper eyelids and have you look down. Your sclera appear to be white and moist. I'm going to make sure that your pupils are reactive to light. I'm going to take my light from both sides of your face. Okay, your pupils are reactive to light. Next, I want you to follow my pen light for me. Okay? Okay, good. Next, can I get you to look at my pen light, then at the wall behind me, and then back at my light? Look to this side. Okay, now look to the other side. Okay, alright, your pupils are round, reactive to light, and accommodating. Next I'm going to do is inspect your nose. If you could look up for me, I'm making sure your septum is midline, and you can look down. With no deviation, your mucous membranes appear to be moist. Can you flare your nostrils for me? Okay. Your nostrils flare symmetrically. Next I'm going to check for patency. I'm going to close one side of your nostril and have you sniff, and then the other. Okay? They're clear. Now I'm going to inspect your mouth. Lift your tongue up, side to side, and say "ah" for me. Okay? Your mucous membranes are pink and moist. Your tongue is pink and moist. Your teeth are white and in line. Your gums are pink and moist. Your lips are smooth, pink and moist, without any lesions. Your palate have no lesions, and your tonsils and uvula are intact. Next, I'm going to inspect your neck. If you could slightly look up for me, your trachea is midline, and your thyroid is not enlarged. Next, I'm going to oscillate your carotid arteries. I'm on both sides. Okay, we do this to check for brewery. If I were to hear any brewery, that would indicate a blockage in the vessel. There was not any brewery, so that's good. Next, I'm going to inspect and palpate your skin on your anterior thorax. I'm going to make sure your skin is intact and consistent with the rest of your body, which it is. I looked for any lesions or edema, and you're clear of those. I checked your temp, making sure I didn't feel any moisture, which I didn't. Well, I already did that, but do it again. Now I'm going to place my hands on your chest and have you breathe in for me. Okay, that's good. I didn't see you using any of your accessory muscles to breathe. Now I'm going to oscillate your lung fields. There are 8 fields. Just breathe normally for me. Okay, the lung fields sound clear from any crackles or bronchi. Next, I'm going to do is put my, I already put my hands on your chest to make sure you're good. Your lungs fell and rose symmetrically. Next, I'm going to teach you how to do a breast examination. Do you do a monthly breast examination at home?
No.
Okay. It's important to do a monthly breast examination, especially if you have any family history of breast cancer. You can do it laying down or in the shower. So I'm going to have you repeat after me. Raise your hand above and behind your head. You're going to start at your axillary muscle, and you're going to go in a circular motion all the way around your breast. And then you'll stop at the nipple and you will squeeze. If there's any discharge or lumps, you need to contact your physician immediately. And you would do that to both sides, preferably at the first of the month, a day you can remember. Okay, now I'm going to inspect your cardiac system, which is your heart. Okay, you can find this at your 2nd and 5th intercostal space. First, I'm going to palpate to see if there is any visual pulsation or thrills. There is not. I'm going to oscillate your heart and your valves on your right side of the sternum in the 2nd intercostal space. And on the right side is your aortic. Left of the sternum in the 2nd intercostal space is your pulmonic. Left of the sternum in the 3rd intercostal space are your herbs. And left of the sternum in the 4th intercostal space is your tricuspid. And between your 4th and 5th space is the mid-clavicular line is the mitral valve, and on the 5th intercostal space is your apical pulse, which I'm going to check it now. It sounds clear from any murmurs or dysrhythmias. Now I'm going to check your posterior thorax. I'm going to inspect your skin and make sure it's consistent with the rest of your body. If you could, take a deep breath for me and exhale. Okay, good. Your skin appears to be free of lesions. It's consistent with the rest of your body. Your lungs rose and fell symmetrically. I'm going to check your spine and make sure you don't have any scoliosis or kyphosis, which you don't. Next, I'm going to listen to the 10 lung fields on your back side to see if I hear any sounds, okay? And I will go over under your right side to listen to the final space. Alright, it sounds clear from any bronchi or crackles. Now I'm going to inspect and palpate your upper extremities. If I could see both of your hands. And I'm going to turn them over. They appear to be free of any lesions or edema. I'm going to check your temperature and make sure I don't feel any moisture, which I don't. Your skin is consistent with the rest of your body. I'm going to check your pulses. I'm going to check your brachial pulses and your radial pulses. They're bilaterally symmetrical. I am going to check your capillary reflexes. If I could have you turn your hand over. And they're less than 3 seconds. I'm going to check your nails for any clubbing, and it's free of clubbing. I'm going to check your skin tugger on your forearms and your upper arms to for any tinting. And there is not. Next, I am going to check your strength. If I could have you push up, raise your arms, push up. Okay, and now push down. Okay, that's good. Now I'm going to check your range of motion. So if you could copy me, do this for flexion, extension, adduction, and abduction. Okay, that's good. Next, if I could have you lay down on your back for me. Okay, I'm going to have you take a deep breath, and I'm going to check your stomach to make sure it is flat and smooth. And your stomach is flat and smooth. Next, I don't see any masses or enlargements. I'm going to oscillate your 4 quadrants for your sounds. I heard active vowel sounds in all 4 quadrants. If I didn't, I would listen up to 5 minutes in each quadrant to see if I heard anything, but they were normal, no hyperactive or hypoactive or abnormal sounds were heard. Next, I'm going to palpate each quadrant and make sure I don't feel any masses or enlargements. I didn't feel any masses or enlargements. Next thing I'm going to do is your lower extremities. I'm going to check your skin and make sure it's consistent with the rest of your body. Okay, and I'm going to lift your legs. Okay, it is consistent with the rest of your body. It is lacking any lesions or edema. I'm checking your temperature and checking for moisture, which there is none. Now I'm going to check your posterior tibial pulse and your dorsalis pedal pulse. They are both bilaterally symmetrical. Now I'm going to check your capillary effects. And it is less than 3 seconds. I'm going to do your strings so that I could have you push up for me. Okay, now push down. Okay, next we're going to do your range of motion. So what I'll have you do is for flexion, bring your leg up, extension, adduction, and abduction. Perfect, and we would do that to both sides. Adduction, extension, adduction, abduction. Okay, your range of motion is within normal limits. Now you can set up. Okay, thank you for letting me do a head-to-toe assessment. We are finished. You can put your shoes back on.